Jars are classified into two groups. Number one, obstetric jars. Number two is a gynecological jar. Obstetric jars are classified into anomaly and disturbed ectopic pregnancy, some tumor like vesicular mole, and others like ectopic pregnancy. Number one, anomaly. This jar demonstrates anomaly in the fetus as anencephaly. Here is the vault of the skull is absent. Here is a fetus showing Frogs sign. This fetus commonly occurring in diabetic mother. This fetus commonly, if delivered vaginally, presenting by the face and leads to shoulder dystocia. The second jar, it shows a conjoined twin. You should note that the two separate heads and the conjunction between the two fetuses are at the chest wall and the part of the abdomen. So this experiment shows fetus completely separate by all organs except the abdomen, so it is named omphalopegus. And here thoracopegus and omphalopegus at the same time, but one head. Looking to this jar contains a fetus inside and a large retroplacental hematoma. The jar is a type of accidental hemorrhage named concealed accidental hemorrhage. Note the blood compressing the muscle up to the peritoneal cavity, and this name in pathology covillary uterus. Here the presentation of the fetus is breech presentation. Okay, this jar contains a very small vesicle designed by histopathology to be vesicular mole. It is a type of benign trophoblastic tumor, and this may be complete or incomplete, mainly presenting by lower abdominal pain, rapid increase in the abdominal enlargement, vaginal bleeding, and may metastasize despite it is benign. This tumor may turn malignant into choriocarcinoma, and its treatment is mainly suction evacuation, then surgical evacuation, and in all cases even hysterectomy. The patient should be followed up by pregnancy test and beta HCG for at least 1 year. This jar containing a pathology in the lateral wall of the uterus. It is rupture uterus. Note the uterus is enlarged. This is a postpartum uterus, and this uterus is showing a lateral wall from the mid of the uterus fundus descending down, including the cervix. And this is a common complication occurring in difficult labor, occurring in instrumental delivery, occurring in obstructed labor. The commonest cause of rupture uterus is previous cesarean section scar, but I think this jar is not following cesarean section scar, and this case is treated by total abdominal hysterectomy. Looking in this jar, this is a complication occurring postpartum named subinvolution of the uterus. It is a state in which the uterus can't regain to the normal non-pregnant state. In this condition, the uterus is still enlarged, and the cause of enlargement may be inside the uterus or outside. Inside the uterus, like small fibroid, infection, remnant of placenta, blood clots, and outside like general anemia and general weakness or infection of the patient. And this case again is treated by total abdominal hysterectomy and bilateral salpingo-oophorectomy. All groups of these jars show ectopic pregnancy. Here the fetus, and this is the tube distended, the remnant of the placenta. Again, here is the part of the uterus named rudimentary hole and a fetus. Here is the tube distended and the fetus is still inside. Here is the tube distended, the fetus inside. Here is the content getting outside the uterus. Okay? All of these types are named ectopic pregnancy. Ectopic pregnancy is implantation of the fertilized ovum outside the uterine cavity. The commonest site is the fallopian tube. And usually, this case presenting by amenorrhea, followed by severe lower abdominal pain, followed by minimal vaginal bleeding or no vaginal bleeding, and followed by shock. All of these cases should be treated immediately, either by laparoscope or by laparotomy and correction of general condition. This is the last one of the obstetric group. This jar containing the uterus and a large ovarian tumor. This ovarian tumor is solid ovarian tumor, and the uterus is open to show a pregnancy inside. This specimen shows the uterus, tubes, ovaries, and the uterus is pregnant about 10 weeks. And with the anterior opened, as you see, to show the chronic tissue and the presenting fetus. The left ovary, as you see, is the seat of a large solid ovarian tumor, and the operation done here is total abdominal hysterectomy and bilateral salpingo-oophorectomy with the uterus inside. It is named sometimes hysterectomy on toto, as it contains the uterus at the same time, the fetus, sorry.